Good evening, Stuttgart military community. My name is Colonel Jason Condrey, your Garrison commander. And I wanted to welcome you to tonight's virtual town hall focusing primarily on COVID. I have with me tonight, returning, Lieutenant Colonel Troy Baker, our public health emergency officer. And I also want to highlight that we've got lots of experts that are joining virtually, prepared to answer your question. We recognize that we're not able to get to all of them during the live stream itself, and want to give you the answers that you want and need. And so before I give an update on some of the things that I know are pressing and on your minds, I wanted to give Troy Baker an opportunity to talk about what we've learned about the virus since he was here with me and talking to you just a few weeks ago.
All right, thanks. Well, it's good to be back. It was a long 2 weeks, as many of you guys have experienced as well. But it's necessary, and it helps out really a lot. We've seen that actually in our community. Overall, how are we doing? We've had consistent and pretty dramatic decline in our numbers. We're nowhere near where we were 2 weeks ago. 2 weeks ago, I was calling Colonel Condrey up at 11 o'clock at night and calling patients up at 10, 11 o'clock at night and telling them they're positive. Not so much anymore. It's gone down a lot. And it has a lot to do with our social distancing, and has a lot to do with people doing the right things. A lot of people ask, how are people doing? And by and large, people that get this, they do pretty good. I'd say the vast majority of people who get this, they feel something for a few days, and then it's over. There are some of them that are that are like, this is the real deal, and it's kind of a no joke thing. They're in their bed shivering, wondering if they should go to the hospital, if they shouldn't go to the hospital. That's a minority, but it's definitely out there. And there's a very few of us who have ended up at the hospital. Some have ended up on the ventilator. We've gotten one of them off of it, but it is kind of a numbers. The percentages are pretty accurate when what you read in terms of how people do with it. Our population, between 30 and 50, they tend to do pretty decently. The older you are than that, you have a little bit rougher ride. Younger than that, much easier. The kids do remarkably well. Most kids and the families that are having it, they'll have it maybe for a couple days, and definitely a lot less than the parents in general. There are exceptions. But for the most part, the kids do great, and many of these families that are getting it, mom will have it, dad will have it, kids, nope, not a thing. They may have had it, it's hard to tell, but the antibody testing might help tease that out a little bit later. At this point, we've shifted from high outbreaks, so we had a couple of kind of point outbreaks that kind of went second, third, and fourth, and fifth generations where people are getting sick. We've shifted away from that into more, we find them, and then we activate our team, the team trace. They go in and they trace the contacts, and they do a deep dive into the workspace, and then we're really not seeing the second, third generation spread that we were previously. So our strategy right now is to maintain our social distancing, as well as to aggressively trace and isolate. And as people ask, what's aggressively trace and isolate? That means if you're having symptoms, then you're in isolation, and your family is in quarantine, and then anybody you've had in close contact with is in quarantine as well. And if they get symptoms, then they shift into isolation as well. Overall, it's working. So the real question is, how do we pivot from our current state to our next state? And really, what is our next state? That's the $1,000,000 question. And if you ask me, and what my crystal ball is, I'd say our next state is a gradual relaxation of our social distancing. We'll probably follow the Germans, almost certainly follow the Germans. Garrison will make those decisions, but it won't be immediate, it won't be universal, it won't be everything. But we're going to and that will gradually relax over time as long as we don't spike again. But the continued aggressive contact tracing and isolation, that's going to continue. I would expect that to continue at least until fall of 2021. So we got a good year and a half of really aggressive contact tracing coming down. What's our future going to look like? Well, the way we get out of this is with a vaccine. We're not going to be able to test our way out of it. We're going to have to get a vaccine. The other way out is the kind of the herd immunity philosophy, which is whatever percentage allows us to reduce the transmission. That's fraught with peril if we go for it aggressively, but the virus may just do it anyways. So we'll see where that goes. And then I get a lot of questions about immunity testing. So that's a big unknown as well. I think it'll help us sort people. If you're not, that'll definitely help out with those decisions. But you got to remember the scale of this. There's 28,000 of us here, and people are going to say, "Well, do it in a month." That's 1,000 per day, which is, even if we can't do it, it'll still overwhelm whatever lab we send those to, because it's not just us. They'll be all in Germany trying to do that. And then what do you do with the people that are negative? You can't just keep them at home. So again, there's a lot of things out there at the testing that are unknown. These things will definitely help us, but our way out really is a vaccination. And until that time, we'll continue with good social distancing, good safe practices, and then aggressive tracing. From Condrey.
Thanks, Troy. So, great update. Lots of information, and I think it highlights the fact that we still have a lot to learn about this virus. And as a result, what we do learn may cause changes in how we do business. I can guarantee that it won't be fast enough for any of you out there. I know everyone's looking to return to some sort of normal, and I'd love to offer an idea of when that's going to be. First of all, I'll say that our individual efforts, physical distancing, hand washing, the way that units and organizations organize for work, and then the things we did as part of the red, white, and blue concept, they've had a significant impact on our community's fight against this virus. From my perspective, I believe we finally have set the terms against an adversary that we can't see, one that we can't really sense. And I think it's important to understand what was going on before we put red, white, and blue in place. Because I drove around today, I saw Blue Group, who I'm proud. Many of you stepped up to the challenge, and when we made the announcement, decided to hold off and hunker down until today that you could come hit the grocery stores, hit the PX. But I think it's important to think back to what things look like in the week before we implemented red, white, and blue. And so in that week before, infections across the community had ballooned. And it was just as Doc Baker had mentioned, late night phone calls, additional reports, people getting called and saying, "Hey, I'm sorry, you now have to be isolated for 14 days. Your family is quarantined for 14 days. A lot of people weren't prepared for that. And although we had implemented measures to keep ourselves away from each other, physical distancing, we were washing hands, we were cleaning surfaces, we had alternate work schedules, mission essential or telework, whatever the case may be, there were still clear indicators of sustained transmission across the community. And it wasn't linked to just one or two cases or events. The next piece was that our asymptomatic testing revealed that people were walking around among us that had no clue that they had the virus. And some of those went all the way through 14 days of isolation, still never having felt a single symptom that would have caused them to stay at home, go get tested, potentially not infect other people. And then because of that sustained transmission, because of the fact that we had people walking around us that were potentially infecting others that didn't know it, we were losing staff. We were losing the people at our critical services, along with members of the community, to self-isolation, self-quarantine. We shut down one of our 2 hotels. The official mail rooms, several of those had to close. A bank, one of our bank branches had to close. The main exchange was closed for a day and a half. And we began to rely on volunteers and service members to make sure we could restock shelves and that we could hand out packages at our mail rooms. So our staff was at 50% or even lower of what we normally had to run day-to-day operations for this community. And from my perspective, the next call was going to shut us down, and probably for at least 2 weeks. And so the red, white, and blue concept was designed with an understanding of the virus. We looked at the services that we had to keep open, and so we decided to arrange how you as the community would use them and how we as the providers of those services would staff them. And so why 2 weeks? Why do I need to wait 2 weeks to go into the commissary, into the PX, into the mailroom? With only 2-3 day windows, to shop for groceries and essentials spread out twice in a month time frame, you were in a community space only 6 total days. That meant that there was a fantastic chance you were not going to come in contact with somebody else that had the virus during those 6 days. If by chance you were infected and you had been infected before your 2-week window started, there was a good chance that the virus would have run its course and you were no longer infectious by the time you came out, and potentially could have spread it to another member of the community or to the staff behind the cash registers. And then within that 2 weeks, that red, white, and blue cycle, 3 5-day cycles, with the first and the last day of that 5-day cycle blocked off to serve as a buffer. That was designed based upon an understanding that it takes about 72 to 96 hours for somebody, based upon our experience with this community, to go from a whisper of a symptom into a test, a result, and some aggressive screening and isolation that allowed us to break the spread and limit it just to people within that 5-day window, within that service. And if the staff was arranged to where there was somebody else scheduled to come in the next 5 days, then at most we would have to close that service down for a day or two. So the next piece that I get a lot of questions about is, why don't you just tell us how to organize within red, white, and blue? The problem with that is most organizations across this installation had already designed a work schedule intended to protect those mission critical functions from the virus. Coming back in afterwards with a Garrison driven process, whether it's alphabetical, whether it's using a DoD ID number, deliberately offset in many cases those schedules that units and organizations had put in place. So I requested that they, using this 3-day model, divided up their workforce in order to make sure that we spread the demand of the community into 3 different areas. All of that put together allowed us to, in time and space, break the path, break the spread of this virus. And so, along with the individual efforts, keeping your hands clean, keeping 6 feet of distance. Now, covering your face anytime you're in some place where you cannot guarantee that you can keep 6 feet of distance. All the things we did as units, the work schedule, teleworking, all those kind of things. And then, of course, the red, white, and blue concept has given us an advantage over the virus. It's an advantage. We haven't declared victory. We're not there yet. We're not in a little bubble. We will never be in a little bubble. We will be impacted by everybody that comes through this area, the communities all around us, the places we live, the nations next door. It's not just our curve that we're focused on. It's hundreds and thousands of curves everywhere that impact us. And until there is something that prevents the virus from infecting those that haven't had it yet, something that gives immunity, it's going to be a consideration, it's going to be part of our lives. And so, yes, we have the advantage. I would say we have set the terms. And so it's great news. I like what I see each and every day. I don't have to get the midnight phone call from our doc. And so the first question is, why don't we back off? You see that conversation here within our community. You see that conversation happening across Germany. And I will tell you that what we're doing is working because we're disciplined. It's working because our working, our shopping, and our living patterns break the path of the virus. It's working because we have staff returning, and that allows us to open up more services and do more things that look like what we all remember just 2 months ago. And so it will only continue to work if we guard against complacency. If we rush back into the way things were 30 days ago, 60 days ago, my concern is that we will have a significant spike and be back where we were just a few weeks ago. And so how long? I still can't answer that question. but I am unwilling to sit back and relax and watch us suffer a setback. I want to be in the driver's seat when it comes to this virus, and I need your assistance to do that. It doesn't matter how much I want it. If the community is not willing to do the things that hopefully you see are having an impact on this virus within our community, if you're not willing to continue to do those things, then we're going to have a problem. We're going to have that setback. So I'll say again, settle in. It's COVID day until it's not. We're setting the terms. I want to keep setting the terms. So, when it comes to how we're doing this, how we'll implement this, we're still learning. And of course, you can't see that because, if you were a red group, you haven't been back in since red group days. You're not seeing what's different for blue group based upon what we observed and what the service providers are doing. There may be the occasional picture out there. Some of them are more helpful than others. But today, as an example, if you were out, you saw long lines. There's lots of things that contributed to that. Perhaps the fact that this is the group that waited the longest. Perhaps it's the fact that stores off the installation aren't open. Perhaps the fact that people are bored and they're not at work today. It's a holiday for some. But those are the things that no matter how much guidance we put out there, I'm not going to be able to affect personal decisions. I'm going to make recommendations. I'm going to ask you to do things. But if everybody in blue group decided to stand in line starting at 10 o'clock this morning, there was nothing I could do about that. I went by all the services this afternoon and I saw that the lines were dying off at the end. I'm guessing that tomorrow it'll be pretty routine. It'll look normal. Those services will be open. Those commissaries that haven't been open on weekends will be open. They'll be open on Easter Sunday as well, even though everything else will be closed. So the supply lines haven't been broken. Sure, there are things that we don't expect to get lots of until August or September. Clorox wipes, Lysol wipes as an example. We don't get as much hand sanitizer as we like. We do have plenty of toilet paper. But there are things out there that we're not going to get as much as we want because the demand on it is so high that those that make those things can't keep up with it. So I mentioned that as we get more staff, we're going to reopen things. We're going to do more. We're also going to find innovative ways to create opportunities for those that don't have, it isn't their turn to shop, how they might be able to get some of those things that they need without having to come into those community spaces, without exposing themselves to the group that's in there and that group that's in those community spaces, without them being exposed to that member of the community. And so for AAFES, I was part of white group. I was standing in line last week that weaved through the aisles next to people that were trying to shop in those very aisles. So today, there's no line weaving, or there's no lines weaving through those aisles. We've taken out a lot of the center displays, and the line goes all the way back. There's one central line for all registers, and people are called forward when a register is open. We've continued to control head count using carts and baskets. The intent is to make sure that we don't have a whole bunch of people stacked in the line, stacked on top of each other. We will adjust those as needed. Some of you are frustrated because you only want to get one or two items and you don't want a cart. From my perspective, the cart naturally creates that 6 feet of physical distancing that we want you to have in line. We've also got stickers on the floor. There's lots of ways that we want to put measures in place that help protect us from this adversary that we can't see. Blue group. You can bypass the line. As a matter of fact, you can use the buy online and pick up in store option and have already paid. It's already bagged. Go back to the customer service area, pick up your order, and then leave. That's a way to bypass the long lines you saw today. With the return of some more staff, I anticipate that buy online and pick up in store will allow us to transition to some sort of curbside delivery. That may require some volunteers, but if that creates the opportunity for a red group or a white group individual to buy online and have somebody bring it to their vehicle at the curb, away from the group that's shopping inside, then we've created an opportunity to deal with some sort of need something that popped up, something that you weren't anticipating the last time you were in the store. Trying to figure out how we can do the same thing with our commissaries. So more to follow on that. The Kelly Express, based upon your feedback, has brought the dry cleaning in. So people that were waiting on dry cleaning, I know we opened up earlier this week for, both on Patch and on Panzer for people to come pick up dry cleaning. On the 18th, the furniture store out on RB will open up again for beverages and water purchases. And so the delivery comes the 17th. The staff will be there to open on the 18th from 10 to 5. And for every Saturday after that, it will be open. And we continue to work with the vendors. AAFES continues to work with the vendors there to get regular dry cleaning operations up, to maybe do some alterations, and then car care. Because I know 'tis the season to change out your winter tires. Vehicles need maintenance. Not all of that can be done by somebody handy with a wrench out in a parking lot. To that point, making some additional services available through DFMWR. On the 14th of April, on Tuesday, the Speedy Lube and Auto Skills, the ability to change oil and change tires, will be open. It will be tire and oil change only by phone. So make a phone call, 30 minutes per oil change, an hour for a tire change. We've put some measures in place that prevent somebody from getting inside your car, prevent somebody from touching your steering wheel. You'll have to be with your car during those periods, the time when the car is up on the lifts. And the only time you will have an interaction with one of the workers there is when you give a credit card so that you can make payment. We'll reopen the Patch Car Wash starting Tuesday as well. It'll be open 10 to 1700, and same. You'll only have to interact with the gentleman running the car wash when it's time to make payment. Outdoor rec. Some of you still have skis. Didn't get to use them very much this winter, but some of you have skis to return. Outdoor rec has the ability to rent bicycles. I know that is a new opportunity that a lot of people would like to take part in. So there's some opportunities with outdoor rec open over on Kelly starting Tuesday, 1000 to 1700. We will find a way to reopen the library. You can check out books online. They'll be ready for you one at a time. People will come in, sign for their books, return books if needed, and continue about their way. Arts and crafts. I know with the new, cloth face covering, lots of questions about when we're going to reopen arts and crafts. We've had some construction over there, and that construction has interrupted, our cash register system. We're trying to get it fixed as quickly as possible. If we had it fixed, it would be open on Tuesday as well. Right now, I'm hopeful that we'll have it up by the 21st. And I know that our MWR team, our arts and crafts team, they've already started making a couple cloth face coverings, and we'll look to have some of those available for those that aren't handy with a sewing machine. So there's lots of questions out there related to cloth facial coverings. Today, I signed and distributed a Garrison policy letter focused on the enforcement or the rules for those. So first of all, anytime that you're going to go into a service facility, you must wear a cloth facial covering. You must present a valid ID card and show it to the screener at the entrance. You must wash your hands or use your hand sanitizer right there at the hand wash stations. And then I'm saying that you need to comply with any screener directive. And that may be answering one of the many questions that you think are mundane. But the point of those questions are to remind you of all the things that fall to the back of our minds as we think about this virus and what we need to do to protect ourselves and others from it. So that policy is in place. As I think about the alternatives available to me as the Garrison commander for those that fail and refuse to comply with that policy, none of them are great options. I don't want to refuse services or access to those services to any member of our community. I don't want to contact an organization, a chain of command, and say this individual refused to follow a Garrison order. I don't want to remove somebody from the installation, bar access, suspend their logistical support, or return dependents back to the United States. All those are horrible options. I want people to do what they need to do with respect to protecting themselves and others against this virus. And I'm determined to make that be the way our community takes care of itself. So the last time I talked about cloth facial coverings, I said I consider it to be the way you visibly tell everyone else around you that you own your personal piece of virus protection, virus prevention, defeating this virus. And so from my perspective, it's a sign of solidarity. It's a sign that we all are in this together. We own this fight. We are setting the terms. So I appreciate the community's patience. I appreciate you allowing us to evolve this to meet the needs that some we anticipated, some we didn't, to deal with some of the second and third order effects. I appreciate the constant feedback, the constructive criticism, and we need it. We will continue to get better. We'll continue to work through this problem until it isn't a problem any longer. And so with that, I think we get to some of the community questions. So I've got one here from Marina. So do people who work in the DFAC, daycare, commissaries, get temporary hazardous duty pay? So that's a great question. Had this conversation because we've been trying to get people to take some jobs in these places that were vacancies. And we've had some, incredible numbers of applicants. And the reality is that none of these people joined these organizations, took on this job, knowing that they would put themselves in harm's way as it relates to this virus. So I've asked the question, do we have the ability to give incentives? And so organizations, whether you're talking about DECA, AAFES, the Garrison, we're looking at ways we might be able to do that. I don't know how yet. I don't know what it will look like. But the reality is these are conversations that we're having. These are questions we have asked as well, and are hoping to have some feedback, because you're right. The things that we considered hazardous before, this virus has changed that dynamic, and people that we, a service that we took for granted, we now see how critical it truly is. And so, short answer is I don't know. Long answer is I hope to be able to tell you soon.
Sir, a couple of questions have come in about school. Marina asks, will we have no more school till after summer? Ina asks, what are the chances of our children going back to school? And Lisa asks, will we go back to school if the German schools start back up?
So, to almost every one of those questions, I don't know. There are some things that have to be determined first. You heard Dr. Baker's intro. We don't know how we're going to be able to control the future spread of this virus. And so until we know more about the virus, decisions about returning to school, where we have a whole bunch of kids from across the community in the same classroom, next to each other, and sure, there may be some ways that we can implement some sort of social distancing, but I don't think we should kid ourselves in thinking that our schools, with the number of students, most of them already over capacity already, are going to be able to ensure that there is 6 foot of distancing and that hands are clean all the time and all the things we now know we must do to protect ourselves. Until we know there's another way to protect ourselves, the question about schools will still be up in the air. And Germany may be able to figure it out before we do. I don't see a future where we choose to go back before Germany does. But again, my crystal ball is no better than most. As we learn more, we'll continue to share that information. I know you'll get information through DODEA channels as well.
Sir, the next question is about physical distancing. Megan asks, Are MPs tasked ensuring that there are not large groups socializing and on post housing? Tons of people are gathering, playing, and working and drinking beer in groups.
So, Megan, as I think about that problem, I'm still relying on parents to do parent things. That's not a law enforcement problem. And the problem with sending MPs in to fix that is it becomes a law enforcement problem. And so, people outside, the weather's great, not surprised by that. And we have very small installations. That's not new news to anybody that's been in Stuttgart for a little while. So how do you find a way to be outside as a family without bumping into the other family that's trying to be outside as a family? It's going to require some supervision. And if there's beer involved, the more beer, the less supervision. And so we're going to continue to roam around. The MPs are going to be present. People are going to be roaming around trying to help us see ourselves better. I've seen lots of, I can't tell you how many pictures I've received of people not following these rules. Again, it comes back to the options available to me to enforce, to restrict, none of which are good. None of which are things that I want to do in times of a global pandemic. So I need parents to do parent things. I want you to find a way to cook out on your barbecue grill. I have no issues with people drinking beer responsibly. But the moment that becomes irresponsible, when we got kids bouncing off each other because they're just not good at keeping physical distance. But I want the social connectedness with the physical distancing. I'm not sure how we do that. It's going to require some deliberate effort. It's going to require parents doing parent things.
Okay, so I have a couple of questions. One of them is Edward asked, have there been instances where one family member contracts the virus and other family members in the same dwelling under quarantine do not contract the disease? So that comes up to the question of contract versus show symptoms. So first off, in the households, there's a pretty high attack rate. Mom gets it, dad gets it most of the time, or vice versa. It's the exception where that does not happen. In a lot of the houses where there's 2 or 4 kids, a couple of kids, especially the older teens, will definitely get something for a little bit and do well. But in other houses, people are all, I had it, my wife had it, kids, nothing. They were perfect the entire time. So it is possible that they didn't get it, or maybe they just got it and they're asymptomatic. And the asymptomatic is kind of a big issue. And a lot of the thought is, it's like the kids, they get it and they're asymptomatic, and a lot of this whole thing driving this may be kids, asymptomatic kids passing to parents and whatnot. Let's see, there's another one. Dawn asks, do you recommend strict indoor isolation for those with asthma and lung issues until COVID is over? No, COVID is going to be a long deal. I'm expecting normalcy fall 2021. That's what I'm hoping. Everything will get nice, and that's what I'm kind of setting my plans for. Anything before then, all bets are off. To stay inside for 18 months, I would not want to do that. But you can be smart about how you do things. Don't go into the supermarkets if you can avoid it. Like the large crowded ones. Don't go to the groups. Just be really smart on what you're doing. Careful. Anne asks, is everyone able to be tested that are showing symptoms, including family members? So testing has been a moving target. We do have some pressure to test less, but at this time we're going to continue as long as we're able to test everyone who comes in who has symptoms or any other reason to get it, and we'll test our family members as well. And that's really kind of most of the cases that we're getting now. Actually, is someone pops positive for whatever exposure they got. And usually the next day is, now the wife has it 3 days later when they come back in. So yes, we will test family members at this time. And then, one more. Daniela asked, will you get the Abbott test machine? We do have at least 1 test machine, I think 2 in the line. They told me about it. I'm not sure if it's the Abbott or something else. Seems like it was a different word. But we will get those, but those take time to run. So just because we have a test machine doesn't mean we can run 60 tests in a day. Some test machines take 15, some take 45 minutes. Doing the math on that, it isn't a huge throughput, and I envision those to be more of a thing when we have kind of the smaller number of cases on a daily basis. For now, we'll ship as much up to launch as we can, and then take whatever we need to with the machine when we get it. Okay.
Okay, I've got several questions here that fall into the PX commissary red, white, and blue enforcement category. So I'll go through these one by one. So Johnny asks, what about retired military people? Do they have a color? So Johnny, I've asked for those that don't have somebody that from their organization saying, hey, you're in this color, based upon when they're scheduled for work, that they pick a color and stick with it. Again, our screeners will not have a list of 28,000 people standing at the door, understanding and checking who's what color. And so I'm relying on the honor system. I'm relying on people understanding why we are doing this and abiding by it, because it's been effective. It's proven to have broken the path of this virus. We're seeing the effects in the community. And so if you're retired or didn't find out what color you were, pick one. Stay with it. Do an assessment of what you have available to you now and let that drive what color you choose. This one was focused on medication. So if you have severe allergies, and this comes from Carolina, and need to get allergy medicine at the PX, and you need to wait, do you need to wait until your shopping day group? So a couple different ways that I recommend solving this problem. First of all, I know within my workplace, those that I work with, what group they're in. I know that if any one of them is going, they will ask me if there's something that me or my family needs. Likewise, I know what group all of my neighbors are in. So in that same scenario, somebody that is going to the PX, going to the commissary, there's a text message, a phone call, hey, I'm going, is there anything you need? There's another option that I'll offer to you, the volunteer button on the app. So whether it's somebody that's not in your group, if you put it out there that you need it, you live on Robinson, hey, I'm on Robinson, I need somebody, if their group shopping is blue, to go and pick up allergy medicine. I can't imagine that you won't find somebody that's able to help with that. Another option, hopefully here in the near future, is the buy online and pick up at curbside. Again, we got to get some more staff back into the store before that's a possibility, but that's how we're going to address that. So this question is about couples that continue to shop at the commissary and PX together, especially during high-risk hours. So I know that's a source of frustration. Just like you, I can't look at somebody and see what makes them high risk. I'm trusting people that are either high risk themselves or shopping for somebody that's high risk to be the ones that use those hours at our PX and commissary. I'm not going to check at the door. I'm not looking for a doctor's note. And yes, a couple that's shopping together would probably make me scratch my head as well. The intent is to minimize our exposure to the community through this process. And especially if you're shopping for a high-risk individual, you want to be as mindful of what you might be bringing back to that high-risk individual as possible. I got two questions focused on masks here. First one is, I want to confirm, this is from Marco, I want to confirm that wearing a mask at the gate at each of our access control points is also a requirement and starts on Friday as well. So, Marco, I am not going to permit or prevent access to the installation for anyone that should be on the installation. I have got screeners wearing masks. I've got pons guards wearing masks. I personally, whenever I go through, because I can't guarantee that I will be able to keep 6 feet away from that pons guard that is scanning my ID card, will be wearing a mask. Again, that's my choice, and me showing everybody that I see that I'm taking the prevention of this virus as serious as possible. There may be a couple people that don't have a mask when they come through the gate. They may not be able to get a mask off the installation. They may be coming home. So I can't keep them outside of the installation. The last question for Maria is, employees at the PX and the commissary, are they required to wear masks? Yes, they are required to wear masks. That's a policy that both of those organizations have put in place, and I think the only exception you will see to that is if somebody needs to scratch their nose or something. So there may be outliers, and I'm sure there will be instances where somebody sees that, but I know supervisors are focused on keeping masks up. Those employees are just as concerned about customers coming through there that don't wear masks. And so they're going to do their part. I do want to highlight that, there's a lot of people taking pictures today. I'm asking you to be mindful of what's in those pictures. There are adversaries out there that are looking for any information that allows them to take advantage during this COVID time. And so pictures of long lines, especially with some of the things that are in the background, not very helpful. So if you've put those pictures up, I'd ask you to take them down. Don't create a physical security risk to highlight the fact that people are waiting for an hour to get into the commissary. A lot of those people chose to wait that long. I think the lines tomorrow will be much, much better, and the next day after that. It's Easter. Sunday morning, we'll have religious services. They're going to be virtual. I know the Catholic service will be online. All the others will be where you can see them. Easter Bunny still has access. Can't get on the installation before 6 a.m., but he's super fast. I have no doubt that he will make all the visits that he needs to. So, wishing everyone that has plans with your family to have a very happy Easter. You had another question?
Sir, we've got two more questions to wrap up tonight's live stream, and these are about return to normalcy.
Okay.
Brenda asks, when all the limitations are lifted, what's the Garrison's plan for the summer PCS, supporting services such as car shipping, household good appointments, and will the Garrison have enough support to provide services when it's that time? And Sandy asks, if all the facilities open again, will they be cleaned and sterilized?
So, two different questions. The first one related to facilities opening. The cleaning and sterilization will happen. The concern about the virus still being present on a surface for in a counter that was closed off 2 weeks ago, I don't think the science supports that as a big risk. I still think the counter needs to be cleaned. And I know that as we reopen things, there are processes to ensure that they're cleaned. The return to normal question. So I think once somebody says, hey, it's time to start moving everybody, and we've lost several months, that there will be a surge in requirements. There will be a need for more bodies than we currently have. And I don't know that we'll be able to find additional bodies to meet that need because every place else will have the same need. And so right now, we're thinking about this problem. We're trying to figure out what we can do in advance. How much of this can we do virtually? What are the true limitations that we're going to experience, whether it's a moving company, whether it's number of flights, whether it's one person that only does one thing? How do we get 2 additional people trained and ready to do that function? Those are the things we're looking at right now. We're looking at what that means 30 days from now, 60 days from now, 4 months from now. I don't know when these limitations are going to be lifted, but we know that we're immediately going to be in a hurry. And we know that blaming COVID is not going to be a reasonable response to why we're not able to do for you and your family what you need us to do. Okay, so I do want to thank Doc Baker for coming in again tonight. He's able to answer questions that I, despite my best efforts, come up really short. I appreciate the patience of the community. I'm thankful for all the volunteers that are working. I'm thankful for all the organizations that continue to support and shoulder more than their share of the task. Continue to look for your feedback. Continue to look as to how we can do this better. I ask for your patience. I ask for your kindness. And as things continue to improve, I need you to stay focused. We can't become complacent. This is working, but it's only working because this community is ensuring that it works. So as we have some days off this weekend, as we welcome the Easter Bunny onto the installation, as we go to sit down as a family and watch virtual church services, enjoy that time with your family, and continue to stay focused on the problem that's in front of us. Every day is COVID day until it's not. We're setting the terms. We will win. Thanks. Have a good night.